Authority. Rundown gets you locked down all day, all time with that traffic report just as and when you want it. With great music and lots more. Lagos Traffic Radio, the driving companion. The colors of life are more vibrant when seen through the lens of healthy eyes. A warm welcome to you, my dear listener. I'm thrilled to be back here to bring you yet another fantastic episode of Eyes on the Road. We've got an incredibly important and intriguing topic to discuss today, so we'll definitely be jumping right into it and make this time count even more. One more time, welcome to Eyes on the Road. I am... Okay, my throat didn't want me to tell you my name, but my name is Akan Usen. Okay, so, of course, while the show continues, we'll definitely be giving you traffic feeds to let you know what things are looking like across the length and breadth of the Lagos metropolis. But without further ado, we'll be going straight into our topic of today. Ladies and gentlemen, boys and girls, mummies and daddies, let's welcome our experts in the building. Dr. Priscilia Imade, a doctor of optometry with a PhD in public health and a consultant optometrist at Modern Eye Clinic, alongside Dr. Rasheedat Aruna, chief optometrist at the Modern Eye Foundation in Modern Eye Care Foundation, in Omoli, Berger. So straight away we'll be having them on the show. Welcome, doctors.
Thank you. Thank you.
While observing Cataract Awareness Creation this month, okay. So, based on the reactions and responses that we have gotten on and offline as regards that topic, we'll be looking at the complications of cataract and why some cataract surgeries are not successful. And we'll be talking about some common complications of cataract, of course, and all that. So, ladies and gentlemen, I will be leaving it to the experts, and they'll dissect. I'm just going to step out to one side. So, ladies and gentlemen, let's welcome the doctors. Doctors, you're welcome.
Thank you very much. Good afternoon, listeners. Like I always say, I'm excited to be here every time, and I'm always happy anytime I'm on air to talk to people about how they can take care of their eyes. And Dr. Aruna has been doing a great work. She was here last week to talk about eye cancers, and I'm sure that was an eye-opener for everyone. And today, in fact, even shortly before I came today, one of my consultants called me, and we had the case of a complicated cataract surgery that she was meant to handle. And then she called me and said, "Oh, Dr. Imade, you need to talk to this patient." And spoke with like, the patient does not understand what I'm saying. Please, can you talk to this patient again? And we had to sit down to start looking at how to make this patient understand the prognosis of this cataract surgery that he wanted to do. You see, there's one good thing that we do in our facility. We will not encourage you to do surgery if we know that the prognosis for that surgery will not be good. Before the surgery is done, we will always, look at all the options. Look at, yes, and then if it's not going to be a win-win or a high win, then there will be no need to do that. So that and other questions we got actually make us to say, okay, today we are going to look at complications of cataract surgery. So people just feel that once they say go and do cataract surgery, after the surgery they are seen and they are good and everything. And if they end up not seeing, the doctor is in trouble, or the facility is in trouble, or one witch and one wizard, is to be blamed. So I know that after today's show, people will be better informed, so that when they are making their choices about carrying out cataract surgery, or even their knowledge about cataracts, would help them to make better choices. Dr. Aruna.
Okay, so I'll just rundown on cataract, okay, because of the color
like a revision.
Yes, just like a revision. So cataract is an opacification of the crystalline lens inside the eyes.
Okay, 1 second. So I have a request. So for the benefit of those who are listening, I know. Let's bring down a bit of our technical lingo. Yes, try as much as possible so that everybody will understand. Opacification, application. So let's calm down. Thank you.
Opacification just means clouding. Okay. It's like a glass that is clear. Okay. Once the glass begins to become cloudy, then you can no longer see through the glass or see yourself through the glass.
Okay.
So that's how it occurs inside the eyes. There's a crystalline lens inside the eyes that works like a camera.
Okay.
And so it helps you to picture things clearly. See, lens is cloudy. Then cataract begins to develop. Sometimes it forms gradually, sometimes it occurs just at once. So it depends on the cause or what's happened, then cataracts can form. So we have types, we have classifications of cataracts, we have the age-related cataracts. So this happens to people that are above 50 years, okay, as a result of aging. The proteins in the crystalline to harden or begins to aggregate, and then it causes clouding of the eye. So this can happen gradually. So from 50, it can be the vision just keep getting worse gradually when the cataract is matured. And when it is matured, then usually we advise for surgery to be done.
I hear that a lot. So when it's matured, what does it mean for cataract to be matured? Because I don't know. Is it that when it covers the entire eye? Or what do you mean by?
All right. So
because somebody was even saying, when I went there, they said I should wait for it to be ripe. Is it a fruit? Does So fruits? Yes. So. What really does that mean?
So it's not a fruit. Okay. So it happens for age-related cataracts. That happens gradually. So we monitor the vision. So we measure the vision. For some instances where the vision is not greatly affected, okay, there's still substantial amount of vision. We don't usually advise. It's not like it can't be done at that point, but usually we don't advise it to be done.
Okay.
We wait for a large amount of vision to have gone. Probably 660, or maybe when a large amount of vision has been affected, then we usually advise for surgery to be done.
Okay. Some of these terms actually, they are public health terms. They are simple terms to make people understand what is happening in the eye. When we use the word ripe, it does not mean that cataract is a fruit. We are just trying to make people understand that there's a certain stage this cataract will get to that it will be easier to do the surgery. Now, also, these terminologies, also, there are old words that came with, analog ways of doing cataract surgeries. Now, there are newer ways now. If they are old, cataract have developed, they just want to change their lens, put a new lens. They don't want to wear glasses. Okay, my lens is weak. Okay, just remove it, put a new one, and I'm seeing again. So some of these words actually is to make people understand what is going on in the eye. And from the topic we are discussing today, complications of cataract.
Yes.
One of the major complications I want to talk about that I have noticed in my years of practice, why cataracts, can get complicated, is that people don't come on time to the eye clinic. 8 years, but he had trauma in the eye. The eye was not attended to. He didn't do anything, left it for years, and now he feels okay. Since it's cataract, I can just remove it and I want to be seen again. Or maybe for cosmetic reasons now, he's feeling ashamed. He just wants, to his ears. And now you are telling him that you can't see very well with that eye. And he seems not to, he seems to be getting disappointed. So there are so many reasons why, if you delay your cataract extraction or your cataract surgery, why complications can come in. Just like Dr. Aruna have said, cataract actually is like a dividing room that separates your anterior eye from the posterior part of the eye. So once that cataract becomes it's no longer clear, light cannot pass through, and you leave the eye like that. It's like the eye is now in darkness. Remember, the eye is the organ of sight, something that God has made to be light. You now left it to be in darkness. Over time, darkness will truly overshadow everywhere, and the structures within will start degenerating. So from what we have found is that, that posterior part of the eye, sometimes when you even take out the cataract, you now discover that this person have developed glaucoma. So even when you have done the cataract surgery,
that was not noticed.
That was not noticed. Yes, that have blocked the view in front. So once that happens, then the surgery is done, that really have degenerated. They have retinopathies.
Oh dear.
So these are some of the assessment that needs to be done before this cataract, can be done. So in addition to, when we weigh all the options, especially if the eye becomes painful or becomes disturbing, if it is better to just remove the eye so that you can have peace, or even remove the
is that an option?
Yes. So for some people, the eyeball can be flames, can be, a lot of complications can come in that warrant you removing the whole eyeball.
Okay.
So we don't pray for that to happen, but we are just saying that we need to avoid complications from cataract. But peradventure they occur, it is not for you to begin to point accusing fingers, maybe at the or at some other sources. These are some of the reasons that can result in those complications. Okay, Dr. Aruna.
All right, let's just quickly remind listeners that the phone lines are open. Feel free to connect with us. I'm sure cataract is something that is really, really common at some point in time. Even if you've not experienced such, or you might have someone in your family, or it might be happening to you, or you just want to know, you want to expand your knowledge base. Feel free to connect with us. 080-991-20777. That's also our WhatsApp line. You can also call 091-538-77127. All right, Dr. Rasheedat, back to you.
So cataract don't only happen to adults, it also happens to children. So children can develop cataracts. Okay. So we have congenital cataracts that happens at birth or during childbirth. This can be as a result of probably the mother being exposed to toxins.
Okay. So that could cause
that could cause the child to
What
develop.
kind of toxins?
So for some people, smoking, alcohol. Okay.
So a pregnant mother who smokes can actually result in cataract.
Yes, it can. It can. Even alcohol. And there's a bacteria called the rubella bacteria, or measles, German measles. So some mothers, if they're exposed to such, especially first trimester of
I have a
pregnancy.
Let's take this. Hello, good afternoon.
Hello, good afternoon.
Yes, welcome. Your name and location, please.
My name is Priscilia Imade.
Okay, please put on. Your name is what? Kunle from Ikeja. Please, could you turn down the volume of your radio set and as you continue? Thank you. Yeah, please go on.
Yeah, this was for a cataract is hereditary.
If cataract is hereditary. All right. Thank you very much for the question. Okay, so the doctors will respond. You can listen over the radio. Or do you have another question?
No.
Okay, thank you so much for calling, Kunle. All right, doctors, let's respond to that even as we continue. Is it hereditary?
So cataract cannot be directly linked to hereditary or gene or something. But the common cause of cataract is age.
Okay.
So once you are old, 50 and above, you are predisposed to having cataract. Once your eyes are exposed to UV radiation, you are predisposed to developing cataract. Anybody can develop.
When you say UV radiation,
yes, UV sunlight.
Do you have that in the sun?
Yes.
So that's all exposed.
Yes, we are all at risk of developing cataracts once we are constantly exposed to UV radiation.
Yes, but in addition to that, primarily it may not be a hereditary problem, but secondarily it can, because most of the genetic factors that are in your parents that made them to develop that cataract are also in you, and by the time you add your lifestyle to that, you discover that at about certain age that your parents too had cataract, you start developing it at that age or even before or above that age. And then let us understand that most eye problems, at least 80% of eye problems, can be inherited. But when you now understand your family history, you can make a conscious effort to avoid or prevent whatever your parents had from affecting you.
Okay.
Let's take a practical example. For some people who are diabetic, if their parents are diabetic and they become diabetic as well,
Yes.
diabetes can induce cataract.
Okay.
Some to have hypertension. The amount of cholesterol in the body and things like that can also go a long way to induce this cataract, in addition to the age. So even if the gene was recessive, but because of our lifestyle, the things you are doing, it can make it prominent. Yes. So that's why we encourage everyone. Now, no matter the kind of eye problem, if you make a deliberate effort, you are proactive to prevent such an eye problem to a reasonable extent, you can actually, reduce the chances of occurrence of such happening to you. The ones that may be difficult for you to accurately prevent are things like refractive error, for example, myopia.
Okay.
You
Long
may
side,
not
short
be
side.
you may not be able to really control that. But cataract is to a reasonable extent, if you understand the pathophysiology or how the disease or how the problem comes up in the body, to a large extent, you'll be able to prevent, if not cataract, but blindness from cataract.
Okay,
You can't prevent
a
that.
quick look at the traffic situation. I can tell you around the Ojota end, from what I can see right here, in and out of the Ojota end, that's on the Ikorodu Road stretch, it's looking really good. And those coming in from the Ogudu Road, trying to connect Ojota via the service lane, well, you have it quite good. You have it good on that end. The Third Million Bridge, of course, we're aware that a part of it has been, closed off for repair works and rehabilitation and repairs. So it's just one stretch that is available for movement. And at this time, only movement for those coming in from the island inwards the mainland is allowed. The movement is in earnest, but it's still looking quite friendly on that stretch at this time. And Mutanjani influx in earnest on the Obafemi Awolowo Way, all the way in and out of the Obafemi Awolowo Way, coming from the underbridge Ikeja end all the way down to the testing ground end. I confirm to you that it's still a good one, but of course traffic light alternation is a thing to take into account. So as you head out, just obey the traffic regulations of it, obey the traffic managers. We're talking cataract and its complications, yes indeed, and we have Dr. Priscilia Imade and Dr. Rasheedat Aruna doing justice to this important topic. So feel free to connect with us, 080-991-20777. Welcome your calls, and 091-538-77127. All right, back to you, doctors.
All right, so I'll just talk about secondary cataract.
Secondary cataract, okay.
Yes, these are cataracts that occur as a result of external factors,
Okay.
not genetic or induced from the
Okay,
body.
can we just quickly pinch this call in? Even as doctor. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Your name and location quickly.
I'm Lawal, calling from Okite.
Okay, please go on.
Yes, I've been listening to your program,
Okay.
and they're very interesting. I have a glaucoma, and
Okay.
I've been speaking with the said it's at the end stage. Not one eye now, and the other eye can it be able to see little things? I want to ask from the doctor. That's my question. But then it takes me on eye drop, so I've been using the eye drop, and it's not forthcoming.
Oh dear, what a pity. Okay, so just listen over the radio. The doctors will respond to this.
So, thank you.
Thank you, Lawal. All right, doctor.
Thank you very much, Lawal. Wow. That question is very pathetic. He's lost one eye,
Quite a
managing the
touching
other
one,
eye. Yeah. In fact, March is Glaucoma Awareness Month. We're going to be talking a lot about glaucoma. So please let everyone tune in and also listen. Glaucoma is the second leading cause of blindness worldwide and the first leading cause of irreversible blindness.
So what can he do now?
For him, It's already advanced, it's already at the end stage. What he has to do, one, he should keep praying. Two, he should continue his medications. He should not stop. The other eye that is still there, he should, as much as possible, follow up with his ophthalmologist, do all the tests that he needs to do, apply all the eye drops as he's told to apply. If he has not done surgery, if there's need for him to do surgery to keep the eye pressure under control, the ophthalmologist will tell him what to do. So please, I just want to encourage him not to sit back at home, but he should still be going for care.
Okay. Let's take this one. Hello.
Hello.
Yes, good afternoon.
Good afternoon.
Elder Tewogbade, welcome, sir.
Well done.
Yes.
I just want to ask from the doctor. His son, does it help at old age? Or is it not friendly with the eye at old age?
Okay. Is the son helpful?
That's what I mean.
Yes, sir. Yes, sir. All right, thank you very much.
Good evening, sir.
Good evening, sir.
Dr. Rice, you want to answer that question?
Fine.
Okay, so let's just respond. Time is not our friend, so let's see how we can,
All right, so the sun, like I was saying earlier, the sun it has UV, ultraviolet rays, okay, which is harmful to the crystalline lens. It's harmful to the crystalline lens. It can, if one has cataract, it can even make the cataract worse, or hasten the cataract to be worse.
So what can one do?
So you need UV protective lenses.
Okay.
Do you understand? Sun shade.
Like a double dose. You're already old. Old age alone can induce cataract. Now you're already old, and with that old age, you are still allowing the sun.
Please turn down your radio set as you tell us your name. Yeah, good afternoon. Your name, please.
My name is Adibunga. I'm calling from my 12.
Okay. Please go on.
In fact, my question, the Mr. Lawal has just answered. I mean, asked a similar question.
Okay.
I'm a glaucoma patient. And I've been on this cinema for over 30 years.
Wow.
So just like Mr. Lawal said, just been advanced. But my children are asking me that I should go for surgery. And I told them that the doctor said there is nothing I can do. But just as you have just mentioned, you did not complete the question. So there is nothing again.
Okay.
Hello?
Yes, sir.
All right, doctor, you'll respond.
There is nothing I can do. I'm over 50. I'm 62 years old.
Okay, doctor, please respond.
And I've been on medication now for over, let me say, close to 20 years.
Wow, that's great. That's great. Thank you very much, Mr.
But they are telling me I should go for surgery.
It's not your children that will tell you to go for surgery. It's your ophthalmologist, the doctor that is managing you, that will tell you to go for surgery. Because when it comes to glaucoma, surgery is not necessarily to make you see. Surgery primarily is to keep the eye pressure under control, which ultimately will help to preserve the eyes. So for some people, once they do glaucoma surgery, they expect that, they were not seeing before. After the surgery, they just start seeing like cataracts. It's not the same thing. The outcome for glaucoma surgery and cataract surgery is not the same. So I will advise Mr. Adegbo again that when this is going for his glaucoma appointment, one of his children should go with him. And then when they get there, they should be able to ask the ophthalmologist or the doctor seeing them what are the prognosis, and then all the tests that have been done.
Tell us.
They should be able, to discuss, have a table conference with the doctor.
Okay. So we have run out of time. Let's see how we can run through secondary cataract and how we can prevent or manage this or treat and prevention.
I'll just touch on that by this question. So the sun is not okay for you to expose your eye to the sun especially once you are old, because it exposes you more to developing cataracts. So I was talking about secondary cataracts, and trauma can cause cataracts. Once you have a trauma to the eye, trauma means anything at all that